have lip lines that are driving you crazy, stay tuned. I am going to work on some clients and show you what I do to lessen lip lines. That's coming up next. Welcome back. Christine Byer here, licensed esthetician for 24 years. And if you're new here, welcome. I do next level treatments to show you how to take your home treatments to the next level. In this video, I want to talk about lip lines. Lip lines are tough. They are, if you're in your 30s, they may just be starting. You may have a little starter one. In your 40s, they are well on their way, and in their 50s, they're probably deeply entrenched. And this happens for a lot of different reasons. Of course, collagen degradation, aging, but also the fact that we lose actual bone, and we lose bone in the jaw, and we lose tissue in our mouth, and receding gums, and all this stuff happens. And so we have less sort of bulk to fill up that skin. And then also some of us are pursers. I'm a purser. I'll be like, thinking about something. And so we've got the muscles that are pulling and just a lot going on there. So what I like to do is a mixture of muscle relaxing and skin enhancing. And so you'll see here, I'm using the Anma. I really like the Anma. This is a gua sha tool. You can grab it and anchor one side of the lips and just go to town. This is really good for relaxing lip lines on the top and the bottom. And I would really not skip this step. This is really important because you're not going to be able to get the lines to look better unless they're flatter, right? So we want to start out with some massage. If you don't have an Anma or any sort of gua sha tool, you can just do these 2 points. This is actually an acupuncture points that really help relax the entire area. So like from here down, especially the lips, but I like to do this because if I do this for a good 2 minutes, it takes away a lot of the extra work I'm going to have to do to relax the lip muscles later. Something about this just makes the tension just drain out of the area. And then when I go in with my Anma, it's just like putty. It's just the muscles have relaxed. So our next step we want to do is some sort of exfoliation. Now, my favorite form of exfoliation for around the lips, because I can use it directly on the lips, is the Skin One Pro. The Skin One Pro is nano channeling. So this is not microneedling. This is a tiny little microchip that has these little cones on it. It sounds really weird, but I'm going to show you here. And used on speed 1, this will be slightly exfoliating, but mostly plumping or product infusing. And so I love to use it for product infusion on the lips. And that's what I'm doing here on Jen. We've already worked out some of the tension, and now I'm going back in. And I've done this on my mother too. Really depends on how much lip lines you have. If you're in your 80s, like my mom, you probably got quite a few. And at that point, I suggest doing deeper, more ablative treatments because you've got to get rid of some of that excess skin. So in Jen's case, she still has good tone. I just want to sort of plump up the skin and get it thickened so that the lines are less visible. Now, at this point, I'm going to take something like, from the facial filling line, the Korean facial filling line, HOP, House of PLLA. PLLA is a biostimulator, and I love to push it deeply into the skin. So I'll grab my Skin One Pro, and I'll put some of the Cavi PLLA on it. And this is a very nourishing serum that works great with the Skin One Pro. And I will just go to town around the lips. And you can actually go right over the red part of the lips with this, which is fantastic because what device can you use on the lips? Most devices say avoid the lip area, but not with this device. You can use it. And I would really start out with level one on the lips, because otherwise you can really, level 3 on the lips, I don't know, be a little too exfoliating because the lip skin is thin. It's very thin. So let's take it easy. Now, at this point, I will put my client, and every client gets LED after their treatment. This is just my protocol. I'll give them a good 10 minutes of LED. I have a super professional, just saturating panel that the actual treatment time is 5 minutes, but you know me, I like to go a little overboard and do more. So I do 10 minutes of LED at the end of the treatment, and they looked positively airbrushed. But remember, you've always got to re-release those muscles and keep everything not tight so that we can get some fresh blood supply and we can get lymph drainage from the area, and everything sort of rejuvenates faster. If the area is very tight and compacted, blood flow is going to be restricted, lymphatic drainage from the area is going to be restricted, and so we need to release before we exfoliate and do any other sort of lifting. I also like to go in with microcurrent or the Time Master Pro afterwards. But if you don't have a Skin One Pro, you would do an exfoliation, and then afterwards always go in with some, like a muscle, like a toner, like microcurrent facial toning, or the very minimum, some LED, because that is going to supercharge and make your treatment a next level treatment. Like I was saying, you want to do once a week if you have a skin that's on the thinner side, twice a week possibly if you have thicker skin, and give this a go for a couple months in a row, and then you're going to start to see some really, really nice results for your lips. Thanks for watching. Bye now.